So thanks again, everyone, for joining us. We are now turning to Module 2 on this honest brokerage approach. And so it's just a quick recap. Last module, we talked about science policy roles, a little bit of the why behind RPC's approach, and strategies for navigating values conflicts in the policy arena. So now we're going to be talking about what it means to be an honest broker, and then I'm going to turn it over to Taylor to talk about how research is used in legislation. Then when we get to the breakout session, we'll be talking about developing a menu of policy recommendations. So picking up where we left off in the last module, we talked a little bit about RPC's approach and how we connect policymakers with researchers who have the right expertise at the right time. And then we shared this slide showing some of the exciting findings that support the model. And one of the reasons I personally find this so exciting is that sometimes there's this sentiment of why bother getting involved in policy engagement? You know, we see how polarizing political issues are anytime we look at the media. And so it's, can I really make a difference in this space? And when we look at this is reason to be hopeful and to be excited to get involved with this work and to really have an impact. And as we are implementing this model, and we're testing it, one of the things we're thinking about is what is the real secret sauce here that's helping us to make these connections and have effective relationships? And perhaps it's not too much of a secret because we have it in the name of the module, but we really do view this honest brokerage approach where we're building these trusted collaborative relationships as our secret sauce. And what we mean by being honest brokers is that honest brokers present science and nonpartisan policy recommendations to congressional audiences across the aisle. So this is agenda neutral support. And when I meet with legislative staff, one of the first things I like to say is we're not here to lobby. We don't have a legislative ask. And this is usually met with really instant positive reactions. It's often refreshing for them to hear because a lot of times they do have meetings where people are coming with an agenda and they do have this legislative ask and they're trying to persuade them. So presenting information objectively, however, helps to really quickly build trust. And so what does this look like in practice? Honest brokers focus on the issues and the evidence to help inform decision-making. And this usually involves presenting a menu of policy options instead of taking a stance on a particular policy. So as one example, one of our recent fact sheets was related to career and technical education. It's a one-page fact sheet, and it concluded with at least 5 different strategies for how you could strengthen CTE programming. Things like evaluating outcomes, improving support for online learners, expanding access to high quality programs. This is a menu of options, not telling the policymaker exactly what they should do or exactly how they should vote on pending legislation. So we're providing that objective information about what research shows. And honest brokers also avoid pushing their own personal opinions and beliefs. So we're providing, again, that objective information, not opinions. And that can include describing how evidence does or does not align with the issues that the legislation addresses. And then finally, we're also focusing on the policymakers' needs and priorities. This is where we have the greatest opportunity for change and impact. Taken as a whole, this is an agenda-neutral, nonpartisan approach which involves advocacy without lobbying. And we often get questions from researchers about this distinction between lobbying and advocacy. Questions like, what can I say or recommend when I meet with the congressional office? How can I make recommendations without crossing that line into lobbying? As we think through those questions, it's helpful to keep a few definitions in mind. So we have advocacy as our broad umbrella term. Advocacy involves supporting or defending a cause or an issue, such as recommending or providing information about an evidence-based program. Researchers can, arguably should, be advocates, but we do need to be mindful of the types of resources that we're using when we interact with legislative audiences in their offices, because that's what's going to determine what restrictions apply. Then we have education. Education is not lobbying. Researchers are not prohibited from providing unbiased information to public officials. In practice, this might look like sharing research findings on evidence-based programs, or even providing information about legislation, as long as it doesn't also involve encouraging the policymaker to take a specific action or providing that opinion about pending legislation. So within RPC's model, we are taking this educational approach. So we might be synthesizing literature, but we're not making a plea for one specific policy strategy over another. We can contrast that with lobbying, which is an activity that does seek to influence the enactment or defeat of pending legislation. So asking a legislator to vote a certain way, that would be lobbying. When we think about how all of this relates, this means that all lobbying is advocacy, but not all advocacy is lobbying. And researchers often wear multiple hats. And when you take off your private citizen hat and instead start representing an employer, or you start using grants or other government funds and resources, that's when we need to start thinking about these restrictions and the compliance issues. And it's important to always be mindful of the type of resources you're using when you're interacting with the legislative audience. So is it your own time? Is it your employer's time? Whose funds or resources are involved for things like travel or communication? If it's federally funded research, nonprofits, government resources, this is when we need to be cautious and aware of what restrictions apply. That said, there's also certainly times when lobbying is allowed and is appropriate, such as when you are acting as a private citizen. In that capacity, you can support political campaigns with your own money, you can advocate, you can encourage your elected officials to vote a certain way. That's your right as a citizen, and having your voice heard in that way, if you so choose, that's a fundamental part of our system of government. So it's not that all lobbying is bad, we just need to know when it's prohibited. And we'll talk in the next few slides about how researchers can educate and advocate without lobbying. And we're going to provide a few practical tips, but we're not able to cover every nuance today. And again, some of it is employer policy specific as well. But I included an RPC practice brief in your additional resources folder, which is also on RPC's website. And that document goes into greater detail, so you can also have that as a resource for the future as well. On this slide, we have a few examples. On the left, we have examples of lobbying. This is referencing a bill that was introduced in the 117th Congress. At the same time, you could swap that out for any other title, any other legislation. And in this first bullet, we see the legislator is being asked to vote for the bill. That would be direct lobbying. Asking them to vote against would also be lobbying. Either way, it's encouraging a specific action. If you were to ask a group to encourage that action, that would be grassroots lobbying. Preparing persuasive materials encouraging a vote one way or another, also lobbying. Then on the right, on the other hand, we have some examples of activities that would not be lobbying. So this could include things like providing information, in this case about student hunger or other education issues. You can even provide updates on legislation as long as you're not also including a specific call to action. That would be education without lobbying. If requested, researchers can also provide technical assistance, such as testifying at a committee hearing. Another example would be sharing model legislation, sharing success stories, examples of what's worked in other jurisdictions. Again, that's all education as long as you don't have that call to action seeking to influence specific legislation as part of that. So it's the difference between here's an example or here's an example, and this is what I want you to do and how I want you to vote with that example. So overall, in general, we can think of this as whether or not we're including a specific ask, whether or not we're giving our opinion on specific legislation. And before I wrap up the lobbying part of this module, just wanted to summarize a few tips that align with our honest broker approach and that we think really help to build trust with legislative audiences. So first, again, we are talking about an agenda neutral approach. In other words, as we just mentioned, no legislative ask. Also, we're not challenging the policymakers' values or beliefs or pushing our own personal opinion. We do want to be honest and transparent with any limitations in our communication generally. So as an example, sometimes a policymaker might ask you a question, you might not know the answer. saying, I don't know, or I don't know, but I'll get back to you. Those are great options. And then it's also very important to respect staffers. And a lot of times you're going to be meeting with the staffer instead of the policymaker directly. And we view this as a really important opportunity and a really important relationship because staffers are influential gatekeepers. They have direct access to the policymaker, they can influence the agenda, and they can also influence how policymakers think about issues. And sometimes we get questions about what does respectful communication look like in this context, where we have these different cultural norms between research and policy communities. And we're going to continue to talk more about that. But one thing to keep in mind at this point is that staffers might not know a lot about your specific area of expertise. And it can vary with different backgrounds, but sometimes the questions they might ask are relatively basic. Sometimes they're even intimidated to meet with researchers, even when they're interested in the insights that you can provide. So being personable, approachable, willing to answer their questions, all of that goes a long way in building trust. Also helpful to keep in mind that learning and communication is bidirectional. It goes both ways. Staffers absolutely can learn from you, but we also can learn from them. They have really important insights into the policymaking process and the policymaker's agenda. So we can definitely ask them questions about what type of support they need and tailor the information that we're providing and sharing based on that. And that doesn't mean that you're only telling them what they want to hear. You're still providing honest information about the evidence, but it's research support that's timely and useful and relevant based on their needs at the time. And then flexibility and adaptability, also key to successfully navigating in the policy arena. This goes back to the importance of timeliness and being responsive to those rapidly changing windows of opportunity that we find. And finally, showing gratitude. Something as simple as saying thank you, thanking them for their time after a meeting can be very helpful. And it's something that we have seen has a positive impact on future engagement. So we also encourage that as well. I'm going to pause here and hand it over to Taylor, or if there's any questions.
Thanks, Emily. So I'm going to segue and talk more about politics, because even though we're not positioning ourselves to ask for specific politically motivated legislative change, we are still better served by understanding the political context and how that shapes decision making so that we can be more effective research communicators. And so thinking about being a research communicator also understands how to prepare for those conversations and really understand our audience. That allows us to make better recommendations that resonate with the person in the room. So to effectively work across the aisle, it means being aware of the motivations and concerns. And the prior slide was a pig in a barrel, because there's a very common metaphor in policymaking is you might not like what goes into the sausage as long as you like the way it tastes. That is where the sausage gets made. So thinking about political processes is often not something that I see my colleagues as enjoying, but knowing how the sausage gets made and that messy process is sort of lifting a bit of a veil, I think, for a lot of researchers. Helps to kind of understand the practical realities that lawmakers face, which not only makes us a bit more strategic, it also potentially helps us to empathize with the role of a lawmaker and understand their practical realities. So by design of our republic, policymakers' role is to serve their states and their districts, which means reflecting their concerns and beliefs and values of the public. And so even if you don't agree with someone's stance on the issue, it is a reflection of those who vote. So it kind of goes back to what we said before about Bill Nye versus Anthony Fauci. And are we working within the system, or are we working to change the system from the outside with public opinion? Both of those roles are very respectable, but knowing what, having a coherent strategy and knowing your audience is really part of this. So if we're working within the system to try and support policymakers' use of research evidence, thinking about their characteristics of their district can really help shape how we inform how they prioritize, how we frame their message. Presenting locally relevant data as an example is really helpful, as well as specific examples of research-based practices that are in their states or related or similar states. Even thinking about the demographic differences, I did even just a high-level analysis of keywords relating to racial equity and state policy. And one of the things that kind of, it wasn't a correlation that I ran, but at a glance, you can really tell that it was not even necessarily states that were left leaning that were always using those words that were related to racial equity and race, but it was particularly states that were much more likely to be racially diverse, whereas even left leaning white states are less likely to use those words. So thinking about how we frame the message often relates to who are the legislators trying to serve and how does it relate to their interests. And sometimes, so, you know, I know a lot of you are focused and interested in racial equity, so I'm going to keep going down that path, even though it has nothing to do with my slide here. John Powell is a critical race scholar who talks about this issue quite a lot and thinks about how to appeal to the dominant majority in power is by trying to kind of counteract the zero-sum game thinking by thinking about framing a message around universal goals, such as third grade reading. We want all third graders to read. And if more third graders are reading, that doesn't hurt other third grading readers, right? So, but the way we accomplish third grade reading may look very different depending on who that third grader is in their life circumstances. And so he advocates for saying more of a targeted approach to addressing a common unifying goal. That's politically savvy because now a policymaker can think about framing it around universal needs about people in their districts, but it also means that you might have policymakers be able to negotiate and see how it benefits their constituents, because ultimately at the end of the day, who do they have to sell that policy to and say this works for you? So back to my slide. As researchers and education researchers more specifically, you're in a sea of many voices and science is one perspective of many stakeholders. And because of this, we have to think realistically about how we shift attention in a tidal wave of voices. So we go to the next slide. I depicted Kingdon's theory in a bit of a different way. I'm a very visual person, and I was in a conference recently where I said something, I kind of got, I don't know, at the edge of my seat, like I have to say this for whatever reason, people had this sort of like frustrating feeling of like, can I convince legislators to change their minds? And I said, I think we have to realize that an individual legislator is like a cog in a wheel of the political system. And so empathizing with the fact that maybe you could change a single legislator's mind, that doesn't actually change the whole political system, in that they're still restricted by what they can and can't do and how they vocalize support or opposition of something based on these constraints of public opinion and the media and how their party thinks about things. And so thinking about these systemic forces shaping individual policymakers' behavior makes us think about strategies that help us to be more effective in working within this political system, and by working to understand these forces. Working within the existing system allows us to offer politically relevant recommendations, and some of that is language, but some of that is also empathizing with various values that are politically diverse. On the next slide, we have I wanted to share with you guys some slides from recent research that I've done with Beth Long and others to do in-depth coding of legislation with the intention of better understanding how policies can be written in ways that use research evidence. So this is all very fresh material. I'm really excited to share with you today. And I started with this slide because I wanted you to understand how the field thinks about these issues before I go into more about what we found from a practical nature. So policymakers use research in different ways, and these are this typology has long existed before I was doing this work. The field often draws upon this typology about how research gets used to better understand policymaker decisions. So one of the most successful ways that we've seen our work have an impact is actually with conceptual use of research evidence. Helping policymakers understand the root causes and consequences of problems is a very conceptual way to use research, as compared to an instrumental use, which would sort of say, this is what works and just do it. I think that instrumental, it's not that it's not possible, but it is a little bit more of an idealistic than a realistic thing in my experience and what I've seen others say. It kind of relates to this notion of, if I just produce the evidence, then people will use it. And in reality, it's a little bit more complicated than that. There's also a saying in policymaking that's like, there's no such thing as a new idea, but you can refine ideas and help policymakers understand how and why things can work in a really nuanced way, which I think is where conceptual use has proven beneficial between researchers and policymaker interactions. Imposed use is different in, I should also point out that I don't believe that these are mutually exclusive ways that policymakers use evidence. Sometimes they can impose their requirements for using evidence, and I'll go into that in another slide. Process is more about the research process itself and how can we leverage that to create new knowledge over time. And tactical evidence is something that I think is, like, to the chagrin of most researchers, the cherry picking of evidence to justify an existing policy solution. And while that can be really frustrating at times, it is something that I've had leaders in my area of study sort of challenge and push back on, of whether or not it's always a bad thing that policymakers are using research in a way that helps to justify their action, because oftentimes that's something that they can use in negotiating with their colleagues and building political will, including educating their constituents on issues, as well as things like helping to sort of motivate change. If it's an effective policy, is it such a bad thing to be tactical and political? It does still ring like confirmation bias, which is where I think we really aspire to be more on the policy development side of things. So I want to also kind of give you some broad-based overview of how we think about policy making. A lot of social policy ends up working toward programs that involve spending that could be in mandatory or entitlement spending or discretionary spending. I'm going to flip back and forth and you guys can see this slide here, is that mandatory spending is actually quite a lot more than discretionary spending. But one thing to be aware of when you're talking with policymakers is that the federal deficit is something that is really salient. And so a lot of congressional committees, for example, have policies, internal policies, that they expect that the committee will cut expenses or budget items if they're going to fund something new. And so it's a cut as you go policy. It can be really challenging, especially if we're talking about prevention policies that often end up paying off in different other ways. So the wrong pocket problem, for example, I think Randy earlier said something about sex education or pregnancy prevention. If pregnancy prevention is being paid for through school programming, that could be paid for by an education budget, but ultimately, where do we expect those savings to accrue? Those could actually end up reducing Medicare expenses, example. Medicaid expenses, I meant. So I think that that's a problem. The wrong pocket problem is something that we're still struggling with in terms of how to figure out how to navigate that. And I don't have simple answers there, except that I do believe that policymakers are really receptive to understanding cost efficiency when we're presenting programs or research-based solutions that may be cost savings, even if our budget projections aren't really capturing those in the standard process. To go back to this slide, sorry, the common policy levers, the accountability and regulation are other ways that we can think about policy making levers. I have this donkey on a stick because and donkey with the stick and the carrot, because it's sort of like, can you provide an incentive for the donkey to move, or do you try and force the donkey to move with a stick? And so accountability and regulatory policies are more like the stick, in that they are sort of creating or enforcing certain adherence. Regulation could be things that even range like safety standards and licensing, although we think about regulation in industry a lot more than social programs. Sometimes you can still think about how that affects program requirements. And accountability is something that I think it is language that policymakers are often apt to respond to, but that thinking about what mechanisms for monitoring and reporting and evaluation, and how those can improve the way that policies are funding effective programs over time. Emily, we can skip back to the 32, use of research in legislation. So I mentioned the studies that Beth and I have worked on. The implications from these sets of studies has helped us not only develop policy frameworks for practical purposes of how we apply research in policy, but also helps us think about ways to continue to evaluate science policy efforts by quantifying metrics of use of research evidence. So on the next slide, covering more of the programmatic angle, think about how research concepts can guide purpose areas of programs. One area where we've seen sometimes policies are not very specific is detailing the kinds of risk factors that programs should be designed to address. So being a little bit clearer about what those are can inform more of the purpose area of what programs are funded. The other is selection criteria. So there are provisions in a lot of policies that explain exactly what kind of characteristics of the target group is intended to be. Who is that? We've seen the word at-risk groups as an example, but you could specify that in different ways. Data-driven practices was also an interesting way that I saw programs using research processes. That includes things like using data to inform the kinds of services that were provided in a community, or using needs assessments, but also using performance goals and professional development in order to improve practices over time. Also should point out demonstration projects as a way to provide a proof of concept of something. That's something that it can even be written into like an appropriations process, is that we're trying to demonstrate that something could be feasible so that it could become more programmatic into the future. In the next slide, we are thinking more about the research and evaluation provisions that we saw in legislation. Those sometimes were specific about study purpose area, and sometimes they were really broad and obscure. And I think that there's a role in terms of what agencies have authority to kind of make their more discretion in their decision making when they're interpreting policies. And so if a legislator wants to, make a very specific study purpose area, then they can, but otherwise they may be relying on the expertise and guidance in the executive agencies to help guide what kind of studies are needed depending on the evolving evidence base. And that's true even of the other slides in this deck as well, is that agencies are arguably have a lot more expertise from a research perspective, or have the ability to think deeply about what the research says and can interpret an evolving evidence base as opposed to legislative language that gets frozen in time. And so having legislation that has parameters on what kind of research-based practice we aspire to see in the world, but still some flexibility so it's not so rigid that it doesn't adapt and change over time is really kind of important, so that as the field begins to learn more things about best practice and pedagogy, for example, that it can be flexible in incorporating more best practices over time. Data infrastructure was another thing that we saw in multiple places. Coordinating systems is a common issue that I hear legislators talking about, is a need for data systems to be able to talk to one another. I think that that's built into a lot of policies because honestly, it's an infrastructure problem, which the federal government sees as one of its roles in providing. The expectations that certain data are collected and reported and analyzed. There were some policies where I saw a list of very specific data elements and measures to be collected, and some were very vague. Some were just like, you must evaluate yourselves, but that was not clear as to what those kind of outcomes would be reported for those programs. The evaluation requirements could also, you can think about this on two different dimensions that I think are relatable as researchers. Is the evaluation funding, is it looking at how to improve practices over time with process quality improvement? Or is it looking at more of like the summative evaluation and thinking, did it work or did it not? And if it didn't, then they're not competitive for funding in the future. I have seen a lot more legislative language that sort of is the latter. And I think that there's areas to grow policy frameworks that get at more of that quality improvement framework of evaluation practice. Examples of the tactical and political language that we saw, sometimes the research, there's actually a lot of bills that will start by justifying its existence by saying studies say, research shows, but they don't really cite their sources, and they just comment that this is a research-based purpose and that justifies and motivates the purpose of the bill. It does provide an opportunity to motivate some conceptual root causes, because those are things that the administrative or executive agencies will interpret whenever they're trying to create guidelines and parameters around executing that bill. We've also seen emotive language, things that are very dramatic language, like, dire and urgency, and things that are, the opioid epidemic, for example. It's an epidemic, is an emotive language choice. So language choices determine political acceptability, and I've seen this in practice a number of times, is a subtle change like you may destroy records versus shall destroy records. It gives more autonomy and choice. In may can be more politically feasible because you have fewer stakeholders fighting back. There's a reason why parenting programs at the federal level have been funded through maternal or early childhood infant home visiting programs. Those are framed around health, and even though they're ultimately working with parents. So thinking about how we use certain language choice that can be defended is important. On the next slide, we have evidence reviews. So as an example of that, some of the gold standard policies that have been written for evidence-based policy have used tiered evidence, which says we're going to define what meets a promising practice as opposed to an evidence-based practice. And usually there's 3 levels where it's you've got some evidence to support you versus a lot of, maybe there's 2 RCTs that have been done that makes you evidence-based. And that allows for policymakers to gear or prioritize funding for programs that have been demonstrated as effective. This is typically rigidly defined by RCTs, and as our studies have shown, there's a lot of other ways to leverage research in the policymaking process. It is something to be aware of, though, because I see a lot of policymakers feel that this has been largely successful in incentivizing programs to demonstrate success, as well as sort of rewarding those that can. We can also look at distilling best practice for dissemination. And so, consistent with even the evidence tiers, at some point, someone has to decide, has this program met these qualifications to be deemed evidence-based? And so an agency or external parties are charged with reviewing whether or not a program or applicant are considered as meeting those qualifications for evidence-based or best practice. And those can be also, but we've seen this go broader than the evidence tiers. So dissemination can be supported through research centers and networks and contractors that are funded directly in legislative language. And just harping on the same point as before, is that non-legislators who operationalize best practice and definitions can evolve with the science, and that's arguably a good thing for science and best practice, because legislators aren't necessarily wanting to put themselves in a position of having to dictate exactly what those practices are, because they recognize that there are people in the administration who can make more specific, in the weeds decisions about what kind of programs get funded within a broad umbrella. My last slide on this is just be prepared to answer what's the cost. When we act as an honest broker, we can appreciate how research gets used. We can craft a menu of policy recommendations designed to educate policymakers without lobbying, but ultimately they're always going to want if they're asking for devil in the details, that it's a good sign that they trust you. I think that sometimes researchers consider this question with a lot of precision, which is not a bad thing in academia, but the time frame for decision making is often so short in policy making that they're usually working with gist-based information and just need to make their best guesstimate to move things forward. And so we have to find ways to provide reasonable cost estimates and a quick short time frame. That's something that I would like to work toward, and the work that we're doing is providing support for researchers to do that. Ultimately, comprehensive use of research and legislation may increase the likelihood that policies are reaching their intended outcomes to benefit those that are designed to serve, and our studies also show that they're more likely to get enacted.